Dear friends, I am Dr. Thompson, Akwo, Ntuba, international physician, certified professional and expert in global health USA, subspecialized in global health communication and medical communication. COVID-19 updates. The new COVID variant named Omicron. The new COVID-19 variant named Omicron. The technical advisory group of evolving or viral evolution has named the B1.1.529 variant of the SARS-CoV-2 virus that has been serologically identified in the nation of South Africa as a variant of interest and concern. And I begin by sending this message of thanks and appreciation to the government, the frontline workers, the bioscientists who have been working so hard in the nation of South Africa to make available their findings to the World Health Organization, and who has communicated, said, through the technical advisory group on viral evolution to the member states of the World Health Organization, the World Health Agency of the United Nations. The Foreign Ministry in South Africa has expressed dismay through the BBC, stating that apparently with the travel restrictions that has been put on South Africa and the other neighboring countries, it's a form of punishment for the country for doing good. Instead of they being appreciated for excellent genomic sequencing work, they are being punished. We appreciate the politics of that. And we are saying as global health experts, to the minister, to take things in stride and to calm down. COVID-19 did not start in South Africa, and it's the SARS-CoV-2 virus is all over the world. And as global health experts, we know that it's the nature of viruses to mutate into variants. And it's the work of the World Health Organization to communicate that which they have to member states, so that the mechanisms which are in place in the member states and their national vaccination programs and their national response or preparedness and response to SARS-CoV-2 and COVID-19 can be reviewed against the new findings. And so I want to say that we, the global health experts of the world, appreciate the work of the South African partners and experts in South Africa, and we thank them for the great work that has led to the sequencing discovery of this variant, which the WHO, through its advisory group, has tagged a variant of concern. We know that it is a variant of concern because of your studies in South Africa, because of the data information that you gave. And that has to do with the WHO looking at the transmissibility, if the variant has an impact on diagnostics and other mitigating measures that are in place. This gives the world the opportunity to act fast. And as Anthony Fauci has said, defending his president as the medical and health advisor to the President of the United States, Joe Biden, the travel ban to South Africa, to Botswana, to Zimbabwe, to Namibia, to Lesotho, to Eswatini, to Mozambique, to Malawi, are not there to punish you. They are there to make sure that, to an extent, the global health community and experts can buy time as the world studies this new variant. There are people who say that these restrictions began in the UK and it spread to other European countries and the EU. That is fine. Nation states have the right to prepare and to respond to pandemic the way they see it fit. They cooperate with the World Health Organization experts, but they are not dictated to by the WHO. But so far, at the last World Health Organization, the contributions of the ministers and secretaries of health of the different hundreds of countries that are part and members of the World Health Organization and the UN system is and was very encouraging. What is being done at the level of the different regions in the Americas by PAO and the countries in the Americas, Canada, the USA, Mexico in North America, Europe, Eastern Europe, Asia, Africa, the Middle East, and all of these countries. This Omicron variant is being studied. We know that the WHO has actually approved about 7 different vaccines that have been used in different parts of the world by member states. But the United States uses the BioNTech Pfizer vaccine, the Moderna, and the Janssen or the J&J vaccine, because that is what the national strategy of the United States uses. The different centers in the United States that are involved in virology and immunology work are studying this. Pharmacologists and pharmacists and people in the pharmaceutical industry and health commodity and medical commodities sector are also working on this. So, though it's of concern in the fact that it's possible that it may evade the immunity that the vaccines provide, it may affect the diagnostics, it may evade other mitigating measures that were put in place. So, work is being done in the medical centers, the medical institutions, the faculties of medicines and biosciences around the world. The National Institute of Allergy and Infectious Diseases, led by Dr. Anthony Fauci, has gone to work. The CDC is put out guiding information. And so, it is not time for people to be pointing fingers at other people. Let us understand the science behind viral pandemics and to understand that it's the nature of viruses to mutate into different variants. Just like there are many germs that we carry, and as long as our immune systems are doing very well, they are not of interest and concern medically. But if our immune systems are affected maybe by HIV/AIDS or anti-cancer medications or other things, then we see that those symbiotic germs or bacteria, fungi, viruses, germs which we carry along every day will not cause problems begin to cause problems because our immune systems have been compromised. So studies have been done. People are advised to now understand that globally, vaccination rates should increase. We should go away from COVID vaccine nationalism. People should respect the public health and social measures put in place. Washing of hands or hand hygiene, contact tracing, respecting of, the fact that we should be away from big crowds and making sure that the big events that are spreaders can be really evaluated and reviewed. So they